Hey, it's me, Dr. G, and welcome back to Friday Morning Rounds. The COVID-19 conversation continued this week on To Your Health with Dr. G with the episode COVID and Kids. This truly was a long overdue conversation, and I'm incredibly glad that it finally happened. Check out my Facebook page, YouTube channel, or website for the full replay. As always, while you're there, go ahead and smash that like or subscribe button and gain instant access to a ton of awesome health content for you and your loved ones. Also, I want to give a huge shout out to Dr. Kate Johnson, MD, board certified adult, child, and adolescent psychiatrist and assistant professor at Loyola University Medical Center, and Dr. Steve Kovar, MD, board certified pediatrician at Kids First Pediatrics, Ltd, and chair of the Department of Pediatrics at Edward Hospital. They both shared amazing insight and expertise on the latest risks and data, psychological impact, and best precautions and expectations as COVID-19 relates to kids. When it comes to COVID and kids, we must continue to set the record straight. I facilitated a great myths versus facts segment this week, but there were a few common statements that I did not have time for. So, here are some additional statements that I must break down. Statement: I can give my child antibiotics or other medications to prevent coronavirus. This is a myth. Antibiotics do not kill viruses, and there are currently no known prescription medications in existence that have been proven to prevent the novel coronavirus. Statement: a child that develops a mental health disorder during this pandemic will simply grow out of it. This is also a myth, and this statement contributes to mental health-related stigma. Mental health disorders are as real as diabetes, heart disease, and cancer. Timely diagnosis, treatment, and follow-up by licensed health professionals always represent standard of care. Statement: it is almost summertime, so I now have to worry about coronavirus being transmitted to children from mosquito bites. Myth again. Mosquito bites will not infect you with coronavirus, which is spread from person to person through droplets in the air when an infected person in close contact coughs or sneezes, or through saliva and nasal discharge. Mosquito bites are not a conduit for coronavirus. Statement: there is no risk to sending kids back to school. Myth. In the US, we still do not know what school will even look like come August. Although COVID risk can never be zero, it remains prudent for school districts to develop and practice a meticulously detailed safety plan that can be implemented on a wide scale. Broad guidelines will undoubtedly be announced at the state level, but individual schools or districts may need to adapt their implementation since numerous inequities continue to exist. Statement: a child can manage a psychiatric disorder through willpower. As I said earlier, this is a myth. A child needs timely diagnosis and management of their mental health condition by a team of experts, including licensed clinicians, therapists, and counseling. Family and social support systems are also crucial in helping children optimize their mental well-being. Statement: my child can catch COVID-19 from my pet. Myth. There have not been any documented cases of pets transmitting the novel coronavirus to humans. However, if you get sick, the CDC recommends playing it safe by not handling pets and keeping your distance, just like you would with people. Last statement: sunlight can kill the coronavirus on surfaces at the playground. This is a myth. While it's true that UV light can decrease the viability of viruses on surfaces, this does not mean that those sick with or at risk for COVID-19 will get rid of their infection or limit their risk due to sunlight exposure. Remember, sunlight contains UV radiation, which poses potential health risks, including skin cell damage and skin cancer. So there you have it. The record has now been set straight. When it comes to children, let us continue to hope that people will make good choices and observe practices that reduce COVID-19 transmission risk. The best that we can do is be vigilant in our preparation for the worst while remaining hopeful for the best. As I've said many times before, preparedness is appropriate, but panic is not. Finally, for the dads out there doing amazing things for their children, happy Father's Day. See you next week. Peace out.